no course. So then Vegeta, we can go ahead and stop recording until, thanks. So want to take some time today to talk through mentorship, what an ideal mentorship relationship looks like, and then some just really tangible tips for you as you are developing a mentor relationship. So here, what is a mentor? What is mentoring? What is kind of the goal of it? You can see here, right? It is actually something that should be fairly dynamic. Sustained relationships are best, and I think that's really facilitated through what we're doing here with global health discovery. And really this space where the mentee, where you can take a key role, responsibility, and be getting really like useful, critical feedback on your activities and your like development as a practitioner, as a researcher. And obviously for us, a big goal here is to help develop longitudinal partnerships, support and equitable partnerships and our host sites, right? All right. And so then in terms of for your growth, we talk a lot in the program about ensuring that whatever we do is impactful, sustainable, equitable for our partners, all very key and essential. But I do want to take some time to acknowledge also your own growth. And I think these are not either or, right? These absolutely can and should be and thrive when they are together. So want to take some time to talk through this, that for you, through any mentor-mentee experience, definitely for discovery, these are the things that we are hoping for you, right? You get to gain some level of expertise and experience just by being engaged in whatever's going on at the host site. I think receiving critical feedback is key and is something that can be lacking, but is really important for growth. So we can talk a bit about how to get that with mentors who are quite busy. Is there a question? Okay. Bismarck, would you mind muting your mic? Sorry. I think another key thing, and it may happen in discovery, but certainly as you enter into residency and beyond, working with others in the field. I think this is actually a really key role for mentors to play for mentees. And as you're an early stage career person as a trainee, being able to establish networks is really huge for your success throughout your career. So this is being able to attend meetings, being introduced, being connected is, I think, something that where it feels appropriate is something that you should definitely be asking for. Another key thing here, I think, is that multiple mentors are great. You do not need to be looking for one mentor. In this program, clearly, you are required to have two, your UCLA and your partner site mentor. But even beyond that, for a lot of the students I mentor, they have myself as their research mentor at UCLA, and then they have another clinical mentor who is in the area of like the specialty that they want to go into, who mentors them specifically on the clinical growth of their career, right? And I think that's great and needed. And so as you're thinking about mentorship, just like any relationship, one person isn't going to fulfill all. Be able to have multiple people fill various roles for you. Okay, so here I have a couple slides that I think are interesting graphics on how to think about mentorship. May or may not be helpful for you, though there's a couple, so if one like strikes you, it can be the one that you kind of think about more. But this one is about a cycle of mentorship. This is when there's like a clear closure. I don't know how often that actually truly happens, but I think when thinking about your guys' projects and for discovery, right now, right, most of you are in kind of this phase, this exploratory phase of building rapport, Contracting meaning like agreeing that you guys are going to work together is really what that means. And direction setting. What are we focusing on? What matters? What goals do we have? And then we'll be moving into still, I would say, I actually think this isn't linear. This is cyclical. So you can be in making progress for discovery and still building rapport, right? It is all this ongoing process. There are a lot of different types of mentorship. And I actually, while a busy and very bright slide from the 70s, I actually find this slide really helpful in thinking about what type of mentorship you need at any given point or for a particular project or goal that you have. So here you can see there's this kind of spectrum. You have highly directive. Basically, this would be more of like a manager style, like you're being told, oh, please do this, look at this paper, complete this activity, and not being given a lot of autonomy over what's being done or how it's being done. And then these up here have more, the mentee has more autonomy, right? And I would think when I think about, I actually use this quite a lot when I am mentoring and thinking about with any given mentee, there's going to be things that fall into various buckets here. And my goal is to ensure that they have at least 50% of what they're doing falls within this more of like coaching, actually. Coaching and like supporting, right? That it is, they're having autonomy, they're being able to kind of create their own, they're being able to make decisions maybe that I wouldn't make, but make their own decisions and learn from activities. And I'm there to guide, but at the end, they get to do what they want to do. And usually with medical students, I try to split this about 50% up here, and then about 50% is more directive, whether that be working on as a second author on a paper that we're already kind of established and is moving. That probably would fall more into this kind of more directive kind of delegating tasks. But really, I think in your discovery, you want to have a mixture of both. If you're finding that all of your stuff is down here, kind of more busy work delegation, it could be a signal of, okay, can I figure out how to carve out something that's more of my own space that takes up a portion of my time to be able to really self-grow, learn, make my own mistakes. Any questions with that? Does that resonate with anyone? I find it helpful, like just as you're going through your mentee experience, particularly I think discovery or planning out discovery, just being able to reflect once a month, kind of where's your activities landing on this, and thinking about, and if you're 100% just here, thinking about, ooh, is there anything that I can like help pick up for my team to just kind of push through tasks in more of this like delegation way that they just need done? Can I do something that's more actually like supportive of my team, right? So keeping that balance in mind. Okay, so you've seen some of these bubbles before when we've been talking about finding your niche. Same, I think, with a mentee. You have various aspects. And really what you want to do is kind of find this in the middle, right? Of that your work, what you do for discovery. And honestly, it's more than what your work for discovery is. It's really more about your relationship with your mentor or your relationship with your mentor's team. For mentors that are really busy, you can talk to our MS3s, MS4s. Sometimes you actually don't interact with your primary mentor that often. You're interacting more with the mentor's team. And so they may assign you a core early scientist or clinician or study coordinator that is your go-to person that will be filling a lot of, somehow I can't go back, filling a lot of these roles for you. And that's great. And that's totally okay. Okay, we're not going to spend much time on this because I think this is all very commonly understood, but needs to at least be acknowledged and said, right? Some of the good qualities, big overarching qualities for a mentee, obviously positive, proactive. I actually do this honest piece, I think is important and can be tough. Honest in a very timely manner about any concerns you have in particular about if you're not sure that the discovery is going in the right direction or something that you're passionate about. The concerns around communication come up a lot because everyone's busy. And so to be open about that quite early, particularly around kind of communication, around if things aren't moving. You can talk with your mentor, you can talk with your other mentor and ask for advice. You can always come and talk to us and to talk through, okay, this is what's happening. What are some strategies to move forward? Okay. And just the more like timely you can do that, the better it will be for your relationship with your mentor and for your project. Okay. Certainly, take feedback, ask for feedback, and openly accept it and incorporate it in. Okay. What are some of the challenges that often happen with mentoring? And actually, I would love to update this slide and just have challenges from our MS3, MS4s, because they, I think, would have a lot to say as well. But I think when you have mentor calls, sometimes it can be a challenge of like what to talk about. And so really thinking that through before you have your meetings, obviously. I think having this kind of reflection point within your mentorship relationship. I talked about every month, 2 months, we kind of do that with my mentees, have a moment of like, let's pause, let's think about that like grid and where's your work falling within this grid? Is the balance okay? Are there things that aren't working? Just these little, having those reflection points, I think is really important, and having them kind of structured in, even if it's just like 10 minutes within one of your calls every 2 months, it can help just ensure that everyone's staying on the same page and any issues are being resolved before they become bigger. Okay. Not all, just this last point, not all mentor-mentee relationships should last. And there are times where and that's okay, and it's good to be able to recognize that and make a change. And I know for those of you who are on foundations now, we've talked about this before. I just want to reiterate, the goal of foundations is for you to explore potential discovery projects. You don't have to if it seems like it's not working or there isn't for whatever reason there's not a fit. You don't have to have that be your discovery site. Obviously, we hope that it does work and that there's a linear movement, but that doesn't always happen. I think last year, did we have 2 or 3 students who did discovery and a couple months after returning ended up switching projects? Okay. Another big challenge is just virtual mentoring. It's hard and ensuring that you guys have the right technology and strategies for communication that work for everyone. If your in-country mentor is virtual at this point, right? It's not for everyone, but I think for a lot of people, WhatsApp is honestly the way as opposed to long emails or even Zoom. Okay, we are at time, so I'm gonna move. Sorry, this is a busy slide, but it's a very detailed tool, but I think it actually helps a ton. And as med students, you guys are usually pretty good at this, but just if you are doing emails, keep them very short, keep them in bullets, you want your mentor or anyone reading it to be able to get the gist of it and any action points within like 10 seconds of scanning, right? If the action point or like main thing doesn't pop out within that first 10 seconds, it's probably not going to get responded to, depending on your mentor. Maybe you have a very like detailed mentor who's who's more kind of consistent with that than I or other people, right? But short, that 10-second rule of action point, main point has to pop out within that 10 seconds. Your email heading, the title of your email needs to really reflect exactly what the topic is about, because people are getting 100 emails a day. If it is urgent or time sensitive, put it in the heading, but don't, like, what is it? The boy who cried wolf. Don't put it in too often that it doesn't actually trigger urgent activity for your mentor. Okay. I think one thing that's been really big for our team is sharing only clean documents. So if you're working on a paper, if you're working on protocols, you can absolutely should be sharing things as you go, and you will talk with your mentor about how frequently they want to see things and check in. But just make sure that the formatting at least is very clean. It should all be the same font. It should all at least like look nice, so that it's just easier to read. It's easier to then focus on the topic and the content if the actual formatting is tight and clean. Same with PowerPoints, and our teams, our broader team, not just students, our broader team often feels like, oh, it's a draft, it's a PowerPoint. I don't want to make it super clean if you're just going to go and change, multiple slides, but it does make a difference. Send it clean and you'll get much better feedback and detailed feedback on the actual content. All right. When you're communicating on calls, be precise. So is there, and we as a team work on this actually quite a lot in our meetings, is there something that you said in 4 sentences that you can actually in 1, right? Or 10 minutes, can you distill that down to its core, say it in 3 minutes, right? And can you lead with your main point, just like writing, right? Thinking about how you communicate verbally as how you would do a good, like, a piece of writing. Lead with your main point. So they have it up front. They're orientated to kind of what you're trying to get at, and hopefully that helps them kind of pay more attention and then continue on. If you are having a Zoom call or meeting, it's super helpful to send any questions, things for people to be thinking about a couple days in advance. I always want to do that. I'm not great at doing that at all, because a lot of times I do my best thinking right before a call or right before a deadline. So that is best practice. Some of us are better at it than others. Okay. Key thing here, I think, also is you're going to get lots of feedback from mentors, depending on what type of project you do. It's important that you be able to respond, take these in, right? Learn from them, but also be able to become your own person, your own researcher, your own clinician, right? And we talk about this a lot with academic writing, that it's this trick of being able to distill from comments what is core and makes the paper better versus what is style. And if it's a stylistic input, that then becomes your choice, right? And just to highlight that this whole process is about you becoming independent, successful, and your own kind of resilient person, researcher, clinician. Okay, we're at time. Per usual, I go over. So I think here, I'll let you look at this on your own. You can see just some basic tips on email that I think are becoming kind of common knowledge here. Sorry, last thing I will say, I think at the end of one thing that is really helpful is to summarize not only agreements, and people do that a lot with tasks, right? I think medical students are particularly good at the end of a call, okay, these are our action points. That's great. Also helpful if you're talking about something complex, to go ahead and summarize it as well, even if it's not an action point, right? So that may be a kind of talking about what is a main challenge that you're having with your project. Discuss and then do a quick summary of, okay, so we agreed this is the main challenge, and then you can do your action points. But I think there's so much benefit to this kind of summarizing back to folks what was discussed. Okay. One tool that I find, and again, these are all just tools that you can consider. One thing that I have found really helpful is using this know your learning style. You can see the website here. It's interesting. It allows you to fill out some questions, take this test, and see how do you engage best. I did this for myself. I don't know why I put Smith as a last name instead of Dovell, but you can see here how I scored, that I'm highly intuitive, more of a global thinker, not very visual, and no, very visual, not very verbal. And so this reflects how I engage best with teams. But a lot of my teammates score very differently, right? So how can we find a medium way of or middle ground of interacting together? So you can check out this website. It has some interesting information of what to do with kind of your scoring and how it could help some of your interactions. Okay, I'm gonna pause there, and we can get into imposter syndrome one of the next calls, or in-person meetings is what we have next, that we'll have. So Vijeta, you can stop recording.